Hi, I'm Javier Jimenez and I'm going to talk about neonatal thyrotoxicosis complication. Definition: hyperthyroidism or thyrotoxicosis is given by the set of signs symptoms that occur as a result of increased free thyroid hormones. T4, T3, high concentration of thyroid hormones cause an accelerated metabolism of body tissues, and hence the symptoms in this patient.
Hey guys, welcome to my video on the thyroid in pregnancy. This is my 6th obstetrics video. So pregnancy is a hyperthyroid state, and that's mainly because HCG mimics TSH. Now, what that means is that, see, this is like the thyroid gland, and what HCG does is it binds to the same receptors on the thyroid gland that bind TSH. So as a result, you have increase in free T4. And this slight increase in free T4 is going to then cause a feedback that makes the pituitary decrease TSH. Now this decrease in TSH can be enough that it actually registers as abnormal. So it's lower than what is a normal TSH value. I also want to point out that there's something called a TBG, which is a thyroxine binding globulin. So these increase due to the increase in estrogen in pregnancy. So these thyroxine binding globulins bind to free T4.
Application in medicine. During pregnancy in grave disease, patient thyroid-stimulating antibodies can cross the placenta like all immunoglobulin G antibodies and stimulate the fetal fetal thyrotoxicosis, which lasts until the maternal antibodies disappear from the fetal circulation.
नमस्कार। आज हम लोग डिस्कस करेंगे हाइपरथायराइडिज्म के बारे में और स्पेशली हम फोकस करेंगे ग्रेव्स डिजीज़ के बारे में। तो हमारा टारगेट है ग्रेव्स डिजीज़ को समझने का, लेकिन उससे पहले हम बात करेंगे थायरोटॉक्सिकोसिस के बारे में। तो थायरोटॉक्सिकोसिस को समझने के बाद हम ग्रेव्स डिजीज़ को समझेंगे। तो चलिए बात करते हैं क्या होता है थायरोटॉक्सिकोसिस। थायरोटॉक्सिकोसिस का क्या मतलब है? थायरोटॉक्सिकोसिस का मतलब होता है हाई कंसंट्रेशन ऑफ T3 एंड T4 और इतना ज़्यादा कि उसके क्लिनिकल मैनिफेस्टेशंस नज़र आने लगें। तो हाई कंसंट्रेशन ऑफ T3 एंड T4 लीडिंग टू क्लिनिकल मैनिफेस्टेशन इज नोन एज थायरोटॉक्सिकोसिस। इसके दो तरीके होते हैं, इसको दो पार्ट्स में डिवाइड किया गया है। तो यह दो तरीके से हो सकता है, एक हाइपोथायराइडिज्म के वजह से और दूसरा विदाउट हाइपोथायराइडिज्म। तो इसके दो कारण माने गए हैं। एक कारण माना गया है कि ये हाइपरथायराइडिज्म की वजह से होगा और दूसरा ये विदाउट हाइपरथायराइडिज्म हो सकता है। अब आप ये सोचेंगे कि ऐसा कैसे संभव है कि विदाउट हाइपरथायराइडिज्म यानी थायराइड के फंक्शन के हाइपर हुए बगैर कैसे पॉसिबल है कि T3 T4 का लेवल ज्यादा हो जाएगा? यहां पर आपके मन में क्वेश्चन होगा, लेकिन इसको अभी हम आपको क्लियर करेंगे, आपको समझाने का प्रयास करेंगे कि यह भी संभव हो सकता है। हाइपरथायराइडिज्म की जब हम बात करते हैं तो सिर्फ अभी जो आप सोच रहे हैं कि थायराइड का अगर फंक्शन ज्यादा हो जाए तभी T3 T4 बढ़ेगा, तो हम उस पर डिस्कस करेंगे। फिर हम चर्चा करेंगे कि कुछ ऐसे भी मामले देखे गए हैं जिसमें थायराइड का फंक्शन बिना बढ़े ही हाइपरथायराइडिज्म के बिना ही थायरोटॉक्सिकोसिस संभव है। तो चलिए हम बात करते हैं पहले कंडीशन की, जिसमें हाइपरथायराइडिज्म की वजह से T3 T4 का लेवल बढ़ने के कारण थायरोटॉक्सिकोसिस होता है। तो इसमें T3 T4 का हायर लेवल ये कब हो सकता है? ब्लड में हाई लेवल ऑफ T3 T4 कब पॉसिबल है? ये पॉसिबल है ग्रेव्स डिजीज में टॉक्सिक नोडुलर ग्वाइटर।
Pros and cons. Pros: the diagnosis is confirmed by elevated levels of T3 and T4 to free, as well as the reduction of elimination of serum TSH comes if the condition is severe and not properly treated. Heart failure and death can occur. Mortality is high, around 15 to 20%.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. I'm Ashraf Khater, Professor of Surgery, Mansoura University, Egypt. And today we will speak about a very important subject in surgery, which is the toxic goiter. At first, we must speak about the causes of thyrotoxicosis. And thyrotoxicosis is different from toxic goiter. Thyrotoxicosis means increased thyroxine hormone in the circulation, either by thyroid source or extra thyroid source. About the thyroid causes of thyrotoxicosis, it may be number one, toxic goiter. Number one, toxic goiter. And the toxic goiter are one of three. The first is the primary thyrotoxicosis, which may be referred as Graves' disease. And the second one is secondary toxic goiter on top of simple multinodular goiter, which is called Plummer disease. And the third one is the autonomously active nodule, which is called toxic nodule. It is just one nodule. It's not a diffuse disease. Then the second cause of thyroid source of thyrotoxicosis may be thyroiditis. Thyroiditis presenting with a thyrotoxicosis. And the third one, or the third cause, is functioning thyroid tumor. Functioning thyroid tumor. Then the extra thyroid causes of thyrotoxicosis, it may be number one, pituitary tumor or pituitary adenoma secreting TSH. Number two, it may be neonatal thyrotoxicosis due to transmission of excessive thyroid hormones through the maternal circulation, which is self-limiting, of course. The third may be what we call factitious thyrotoxicosis or thyrotoxicosis factitia.
Issues of bleeding or a study was carried out of 289 pregnant women at the Isidro Ayora Gyneco-Obstetric Hospital in Quito in 2015. 2.5% of women who gave birth present alteration in thyroid function in their babies.
The symptoms of hypothyroidism are numerous. They include heat intolerance, palpitations, dyspnea or shortness of breath, tremulousness, menstrual irregularities, an increase in the frequency of stool and diarrhea, weight loss and increased appetite. In the rest of the body, there may be proximal muscle weakness. Patients may manifest fatigue and difficulty sleeping. They may also have mood disturbances and be very irritable. In older patients, the classic symptoms tend to be absent. However, cardiac manifestations are much more prominent. Patients may present with abnormal heart rates or atrial fibrillation and may eventually develop heart failure. The patterns of abnormal thyroid function tests are as follows. The initial evaluation is always based on the clinical signs and symptoms. Check a TSH alone initially to gauge whether the patient is hyper or hypothyroid. In the setting of suppressed TSH, then go on and check a T4 and T3 level. The typical pattern of hypothyroidism seen in this case is a low TSH and an elevated T4 and or elevated T3. This is the hallmark of primary hypothyroidism.
Conclusion: this rare condition affecting 1 to 5% of infant mothers with grave hyperthyroidism. During pregnancy, the fetus is protected by the antithyroid drugs given to the mother.
Hi, I'm Dr. Raymond Douglas. I'm an oculoplastic and orbit surgeon here in Beverly Hills, California. And today I'm joined by Dr. Pejman Cohen, who's an endocrinologist here in Beverly Hills and treats patients with Graves' disease. Today we're going to be speaking about pregnancy and Graves' disease. And this is a very hot topic. And I look forward to learning a lot about the thyroid management during this process. But Dr. Cohen, what can we begin to learn about what happens in pregnancy with patients who have Graves' disease? What are their symptoms, and what can you kind of tell us that they should be looking out for during this process?
Absolutely. So Graves' disease is an autoimmune condition, and pregnancy is generally a state of a down-regulated immune system. And so in the situation of a woman who has Graves' disease and then becomes pregnant, a lot of times the condition actually gets better because the immune system is not as active, and therefore the condition of Graves' disease actually quiets down a little bit. Now, that doesn't always happen, and so women who are pregnant need to be monitored extra carefully compared to women who are not carrying a baby, because if the hyperthyroidism is uncontrolled, it can have negative consequences not just for the mom but for the fetus as well.
Okay.
So we really track patients with Graves' disease and pregnancy carefully. It is a team effort where we're working with their obstetrician. Sometimes, depending on how severe the condition is, they may be seeing a high-risk obstetrician. Not always, but sometimes. And we're monitoring their levels very carefully.
Yeah.
Thank you very much.